can I come in? Yes. Okay. Close curtain, hand hygiene. Hi, my name is Jada. How are you doing today? I'm just gonna be doing a postpartum assessment that includes just assessing your breast if you breastfeed and checking intimate parts and checking your umbilicus. Is that okay with you? Yes. Okay. Alrighty. So I'm going to check her wristband with my chart. Her name and date of birth is correct per my chart. I'm going to raise the bed to a comfortable height and put on some gloves. Alrighty. So I'm just going to go ahead and ask you a couple questions. Do you breastfeed or formula feed? You breastfeed, okay. And did you have a C-section or did you have an episiotomy? Did you have a natural birth? Okay, very good. All right, my patient breastfeeds and she had a C-section. Very good. So first I'm just going to be assessing your lung and your heart sounds, checking for BMI. Is that all right? All right. So I'm just going to go ahead and uncover her and prep her and listen to her lung sounds and her BMI. When I listen to lung sounds, I'm going to go within a zigzag pattern, and also I do want to state that the tech did take the vital signs and they are within normal limits. I did an environmental check. The patient has no IV bags. The patient has no oxygen or a catheter. The only thing the patient has is an IV present in their right forearm. But I just want to state that. And secondly, I want to say that this mannequin is a functioning mannequin, so I was advised not to turn her. So whenever I listen to lung sounds, I'm going to try the best of my ability. I'm going to reach in behind. All right, and I just want to verbalize that as well. All right, I'm going to begin. When I listen to lung sounds, I'm going in a zigzag pattern. Deep breath in, deep breath out. 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 I'm gonna look and reach in the back. Okay, no vesicular lung sounds noted. And are you in any pain? On a 0 being no pain and 10 being the worst. 0, okay, patient says she's not in any pain. And while I'm here, I'm going to be assessing and looking for the apical pulse. It is in the 5th intercostal space, so I'm going to look for 1 minute and check for BMI, starting now.
So tomorrow I can put the Foley's, tomorrow night, put the Foley's, and I can use the kid.
So I was requested to do the shadowing.
But don't you think they really do it? Because the bed baths, they can't really do bed baths in there.
I texted her
And
the
it's
other
just
day,
so
like,
heavy.
hey, we got a chance to look.
Bed
They
baths,
have nurses, so
and
they're having to do
we can't really use Susie, like you said.
I'm still assessing.
And they can do the restraining.
For apical.
Bed baths, right there and there, and then.
And possibly they got voluntary examination, which I might submit those out if I publish for school. I was planning.
Alrighty, BMI is within normal limits. Okay. And so before I assess her bowel, I am going to look at her breast and palpate. I'm just going to undo your gown. Is that okay with you? Yes, okay. I ask permission. All right. I'm just going to palpate your breast. Tell me, do you have any pain when I do this? No pain, no tenderness. I don't see any redness, any warmth. Since the patient does breastfeed, I'm going to be looking at the nipple. I'm going to be checking for bruising or any excoriation on the skin. That would tell me if the baby had an improper latch, but the baby does not. The breasts are within normal limits. Thank you so much. And also, I'm just going to go ahead and listen to bowel sounds. Have you had a bowel movement today? Yes, you have. Okay, she's had 2. And are you passing gas? Yes, she has. That is a sign of functioning bowel. Any pain or tenderness down there? No pain or tenderness. Okay, very good. And I'm going to listen to the bowel sounds and then I will assess. I'm going to start in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, bowels are active and within normal limits for the patient. Since my patient did have a C-section, I'm going to be looking and assessing for with Rita, and the patient doesn't have a surgical dressing. She might have some surgical glue and incision, and I'm just going to just be checking that and making sure it is warm, it is normal for her, no bleeding, bruising, or abnormalities within that. C-section, skin looks good, and I'm going to be checking her umbilicus. And when doing that, I'm going to be also assessing for a boggy fundus. I'm just going to kind of go down and feel. It does feel firm. It is midline, and it is U1, which is appropriate for her. Okay, thank you so much. And also I'm just going to ask, have you had any burning, dysuria, frequency peeing, or urinating? No, you haven't. All right. And I'm also going to be looking and checking for the loca. I'm going to assess her intimate area and make sure she has no hemorrhoids, or since she didn't have an episiotomy, I'm not going to be looking for a surgical side because she had a C-section, but I'm going to be checking loca. Have you been, how many pads have you been going through? One? Okay. Looking at the pad, and I do see a skim amount of blood. Have you passed any clots? You passed one clot. Patient says she passed one clot. The blood, I'm looking at the amount, is very small. It is red, but it's a skim, very skim amount of blood. Have you noticed any burning or discomfort? Okay, and bleeding has not been a lot at all. Okay, very good. I'm checking the skin integrity. Skin is intact. No excoriation. No hemorrhoids visible. Okay, and most importantly, no odor. Very good. So I'm going to be checking for home and sign. I'm just going to be checking the reflex and seeing if you have any pain or discomfort behind your cow. All right. So what I'm going to be doing, I'm just going to put my hand under the thigh supported as with her foot as well. I'm just going to flex the patient's foot. Does this hurt? Do you feel any pain or discomfort? No. I'm going to be checking and assessing for any redness, warmth, tenderness, arrhythmia. Do you feel any pain? No, you do not. Very good. I'm going to do the same with the left foot. Alrighty. Going to do the same thing. Lift up with the thigh, flex the foot. Any pain, discomfort. Check for redness, tenderness, swelling, arrhythmia, anything. Nope. Very good. Skin was within normal limits. Also, I'm just going to ask about your mental status. I know giving birth can be very challenging and hard. How do you feel about having a baby? Very happy. Very good. I'm glad to hear it. Have you been getting adequate sleep? You have. You're a little tired today. That's understandable. Have you been depressed, sad, or anything of that sort? No. Patient says she is a little bit tired, but the patient denies being depressed or sad, anything of that sort. Okay, very good. Well, congratulations on having a child. And I'm also, when I did the environmental check, I did notice that the patient has a IV on the right forearm, and I'm just going to check the integrity of that. Going to check the skin. I'm going to see if the IV is intact. The IV is intact, and it is dry. I'm going to flush it to see if the IV still works. I flushed the IV. The IV is still intact and it works. I'm going to lock it. Thank you so much. Alrighty. And are you comfortable? Do you have any questions? Are you in any pain? No, the patient's not in any pain. The patient is comfortable. I'm just going to lower the bed. For safety, do you need to be repositioned? Patient says no. The patient says she's just tired. All right, I'm gonna place the call light within reach and no questions. All right. And if the patient was in pain, I would assess the pain, and I would see what I have ordered, and I would educate on pain meds that I have available, and also I would educate on non-pharm interventions that I could do. Well, thank you so much for the assessment. Thank you for your patience, and congratulations on having a child. Call it within reach. You want your curtain open or shut? Shut? Okay. I'm going to close curtain and practice hand hygiene.